Your beloved dog is clearly uncomfortable. Maybe they are scratching their raw, itchy skin or pacing from a sudden upset stomach. But it is late. The local vet clinic is closed, and the nearest emergency hospital is miles away, charging hundreds just to walk through the door. Naturally, you look inside your own medicine cabinet. You wonder if a tiny dose of your own medicine could bring them peace. But fear stops you. You know that some human pills can cause rapid liver or kidney failure. That fear is justified, but veterinarians have a secret. There are exactly 9 everyday human medications that are incredibly safe and highly effective for dogs. Vets even prescribe these exact formulas under expensive labels. Before we look at the first remedy, you must watch out for one silent, common sweetener hiding in human pills that can cause a fatal drop in blood sugar. Let us start with a medication that almost every single household has in their bathroom drawer. If your dog suffers from seasonal allergies, they do not usually sneeze the way we do. Instead, their allergies show up directly on their skin. They will scratch their belly, bite at their paws, rub their face on the furniture, and shake their heads constantly. When this happens, their body is releasing a flood of chemicals called histamines. To stop this painful cycle, you need a powerful antihistamine. The most widely used and veterinarian-approved option in your cabinet is diphenhydramine. You likely know this medication by its incredibly popular brand name, Benadryl. This simple pink pill is highly effective at blocking those histamines. It can bring your scratching dog immense relief within about 30 to 60 minutes. It is also an absolute lifesaver if your dog is stung by a bee, bitten by an insect, or has a mild allergic reaction to a vaccine. But you cannot just grab any box of Benadryl off the shelf. You must look closely at the active ingredients on the back of the box. The only active ingredient listed should be diphenhydramine. Many modern allergy formulations add decongestants like pseudoephedrine or phenylephrine to help humans with sinus pressure. If a dog swallows these decongestants, it will send their heart rate into dangerous territory, causing severe anxiety, seizures, and potentially fatal high blood pressure. Keep it simple. Stick to the plain original formula. But what if your dog is prone to extreme drowsiness from Benadryl? Or what if you need something that lasts longer for chronic skin itching? If you want a non-drowsy alternative that keeps working for a full 24 hours, you can look for another common allergy medication in your cabinet. This is cetirizine, which is commonly sold under the brand name Zyrtec. Cetirizine is a newer generation antihistamine. It does a fantastic job of calming down inflamed, itchy skin without making your dog sleep the entire day away. It is highly favored by veterinary dermatologists for dogs who suffer from chronic pollen or grass allergies throughout the spring and summer months. Just like with the previous medication, you have to play detective with the packaging. You must ensure you are buying plain Zyrtec and absolutely never Zyrtec D. The D stands for decongestants, which are highly toxic to your dog's nervous system. When you use these allergy medications, the standard rule of thumb is to base the dosage strictly on your dog's weight. While itchy skin is incredibly frustrating, there is nothing quite as stressful as dealing with a dog who has a sudden, messy digestive issue. Fortunately, there is a gentle pink liquid in your pantry that can soothe their stomach instantly. But you have to use the right version, or you could end up causing a hidden internal crisis. We have all dealt with a dog who has a loud, gurgling stomach. They might refuse their breakfast, pace around, or start frantically licking the carpet or eating grass in the yard. When your dog's stomach is highly acidic and upset, you can reach for famotidine, widely known as Pepcid AC. Famotidine is an acid reducer. It works by actively turning down the volume of acid production inside your dog's stomach. This brings rapid relief if they are suffering from acid reflux, mild gastritis, or if they tend to throw up yellow bile in the morning on an empty stomach. It acts as a protective shield for their delicate stomach lining. In fact, vets frequently use this exact medication when a dog is taking heavy anti-inflammatory drugs to prevent them from developing painful stomach ulcers. However, many pet owners confuse this safe option with another famous pink stomach medication, Pepto-Bismol. You must exercise extreme caution here. Pepto-Bismol contains an active ingredient called bismuth subsalicylate. Salicylates are in the same chemical family as aspirin. If you give Pepto-Bismol to a dog, especially one already taking other anti-inflammatory medications. It can trigger severe bleeding in their stomach or intestines. Furthermore, Pepto-Bismol will turn your dog's stool a very dark black color. As we know, black stool is also the primary warning sign of internal bleeding. Using it makes it incredibly difficult for you or your vet to tell if your dog is actually bleeding inside. To keep your dog safe, leave the Pepto-Bismol on the shelf and stick to the plain famotidine. But what if the stomach upset has already traveled further down the digestive tract, resulting in a sudden bout of watery diarrhea? There is nothing quite like waking up in the morning to find a giant, watery mess on your living room rug. Diarrhea can happen for many reasons. Your dog might have eaten a rich scrap of food from the garbage, or they might have a minor bacterial imbalance from sniffing around outside. If your dog is otherwise acting completely normal, energetic, and happy, you can help firm up their stool using a highly safe over-the-counter medication called loperamide. You likely know this as Imodium. Loperamide works by gently slowing down the physical movement of the intestines. This allows your dog's body to absorb water from the waste material properly, quickly turning liquid diarrhea back into a solid, manageable stool. But there is a major warning you must hear before you ever use Imodium. Certain herding breeds, including collies, Shetland sheepdogs, Australian shepherds, and whippets, frequently carry a specific genetic mutation called the MDR1 mutation. This mutation prevents their bodies from pumping certain medications out of their brains. If a dog with the MDR1 mutation takes Imodium, the medication can cross the blood-brain barrier and cause severe, life-threatening neurological toxicity. If you own a herding breed, you should avoid Imodium entirely unless your dog has been genetically tested and cleared of this mutation. If your dog is safe to take it, always make sure you are using the plain caplets and never the liquid versions that might contain artificial flavorings. This brings us directly back to that dangerous silent ingredient we mentioned at the start of our video. It is the single biggest threat lurking in your medicine cabinet. Before we discuss the next highly effective medication, we must address the silent killer that is finding its way into more and more human pharmaceutical products every single day. That ingredient is xylitol, which is often listed on modern labels as birch sugar or wood sugar. Xylitol is an extremely popular artificial sweetener. Humans love it because it has virtually 0 calories and does not spike blood sugar levels. You can find it in sugar-free chewing gum, peanut butter, throat lozenges, and a massive variety of liquid medications, chewable tablets, and pediatric syrups. But inside a dog's body, xylitol acts like a chemical bomb. When a dog ingests even a tiny trace of xylitol, their pancreas mistakes it for real sugar and releases a massive, uncontrolled flood of insulin. This causes their blood sugar levels to crash to dangerously low levels in a matter of minutes. This state of hypoglycemia leads to immediate weakness, loss of coordination, seizures, permanent liver failure, and death. You must make it an absolute, unbroken rule. Before you put any liquid medication, chewable tablet, or sweet-tasting pill into your dog's mouth, you must read every single line of the inactive ingredients list. If you see the word xylitol, birch sugar, or wood sugar, keep it far away from your pet. Now that you know how to protect them from this hidden danger, let us look at a brilliant household solution for those times when your dog gets a painful cut, scrape, or skin infection. Dogs are active, adventurous animals. They run through brush, dig in the dirt, and occasionally get minor cuts, scrapes, or hot spots on their skin. When you notice a small superficial wound, you do not need a prescription veterinary ointment. You can walk right over to your first aid kit and grab your tube of triple antibiotic ointment, commonly known as Neosporin. This classic ointment contains 3 powerful antibiotics: bacitracin, neomycin, and polymyxin B. Together, they do an incredible job of killing off common surface bacteria, keeping the wound clean, and accelerating the natural healing process. Applying it is simple. Clean the area gently with warm water and mild soap, pat it dry, and dab a very thin layer of the ointment directly onto the scrape. But here's the challenge when dealing with dogs: they love to lick. If you apply a thick, globby layer of ointment, your dog's immediate instinct will be to lick it off. While the ingredients in Neosporin are relatively non-toxic in tiny amounts, Swallowing a large amount can cause a highly upset stomach, vomiting, and diarrhea. Even worse, the licking action introduces fresh bacteria from their mouth directly into the open wound, making the infection far worse. To prevent this, apply only a tiny smear and rub it completely into the skin so there is no excess residue. You can also distract your dog with a high-value treat, a short walk, or a puzzle toy for 15 minutes immediately after application to let the medication absorb safely. But what if the irritation is not on their skin, but rather inside their dry, red, or irritated eyes? Just like us, dogs can get debris, dust, or pollen trapped in their eyes. This leads to squinting, redness, and a clear, watery discharge that makes them look incredibly uncomfortable. If your dog's eyes are mildly irritated from a dusty day at the park, you can bring them quick relief using sterile saline eye drops. Plain saline drops are completely safe and highly effective for flushing out foreign irritants, dust, and allergens from the surface of the eye. It is a fantastic tool to keep in your dog's travel kit, but you must be incredibly precise when choosing an eye drop. You must only use plain, sterile saline. Do not ever use medicated human eye drops, especially those designed to get the redness out, such as Visine. These redness relief drops contain active ingredients like tetrahydrozoline, which work by constricting the blood vessels in the eye. If your dog absorbs this chemical through their tear ducts or accidentally licks a drop off their fur, it can cause severe cardiovascular issues, including a dangerously slow heart rate and profound lethargy. Furthermore, if your dog is squinting heavily, pawing at their eye constantly, or if you see a thick, yellow-green, pus-like discharge, they could have a corneal scratch or a deep infection. Using the wrong drop on a scratched eye can lead to permanent blindness. If plain saline does not bring relief within a few flushes, it is time to have a professional veterinarian check their eye with a special diagnostic stain. Now, let us move on to a common digestive issue that causes intense discomfort for both you and your dog: trapped gas. Sometimes gas gets trapped inside your dog's digestive tract, causing their belly to feel tight, hard, and highly uncomfortable. They might whine, struggle to lie down, or stretch out with their chest to the floor and rear end in the air. When your dog has painful trapped gas bubbles, you can safely use simethicone, famously known as Gas X. This medication is incredibly gentle because it is not absorbed into your dog's bloodstream. It works through a simple physical process, changing the surface tension of the trapped gas bubbles. This causes tiny, painful bubbles to merge into larger, flatter ones that your dog can pass easily. But you must know the difference between simple gas and a life-threatening emergency known as bloat or gastric dilatation volvulus. If your dog's stomach is visibly swollen like a drum and they are panting, pacing anxiously, and trying to vomit with nothing coming up, their stomach may have physically twisted. Simethicone cannot help a twisted stomach. This is a severe medical emergency, and you must get them to surgery immediately. For simple gas, however, simethicone is a brilliant remedy to keep on hand. This brings us to our next medication, which is an absolute necessity if your dog struggles with motion sickness during car rides. Many dogs love the idea of going for a ride, but their physical bodies do not always agree with the motion of the car. If your dog starts drooling heavily, trembling, or vomiting the moment you hit the highway, they are suffering from motion sickness. This is incredibly common, especially in younger dogs whose inner ear structures are still developing. To make travel enjoyable for both of you, you can use dimenhydrinate, widely known as Dramamine. Dramamine works by calming down the overstimulated motion sensors inside your dog's inner ear and blocking the chemical triggers in the brain that cause nausea. Giving your dog a dose of Dramamine about 30 to 60 minutes before you start the car can transform a stressful, messy road trip into a peaceful, relaxing journey. It is also highly useful for mild nausea from other temporary stomach upsets. Always ensure you are using the plain, original formula Dramamine, and be prepared for your dog to be a little sleepy during the drive, which is often a welcome benefit for a highly anxious traveler. Our final medication is one of the most powerful emergency tools you can ever have in your home. It is a remedy that you hope you never have to use, but when you need it, it can literally mean the difference between life and death. Imagine walking into the kitchen to find an empty, chewed-up box of dark chocolates, a spill of sweet-tasting antifreeze, or an empty bottle of prescription pills. In a poisoning scenario, time is your greatest enemy. Every minute that toxic substance sits in your dog's stomach, their body absorbs more of it. If you cannot reach a clinic within 15 minutes, you may need to induce vomiting at home. The safest, most reliable household tool for this is 3% hydrogen peroxide. When given orally, it acts as a mild irritant to the stomach lining, triggering a rapid vomiting reflex within 5 to 10 minutes. But you must follow the safety rules perfectly. First, use only a fresh bottle of standard 3% hydrogen peroxide. Never use stronger formulas like hair dye developer, which cause severe chemical burns. Second, always call poison control or your emergency vet first. If your dog swallowed something sharp, like glass, or a corrosive chemical like drain cleaner, forcing it back up can cause twice the damage. If it is safe to vomit, the standard emergency dose is 1 teaspoon for every 10 pounds of your dog's body weight. Keeping a fresh bottle and a plastic syringe on hand is your ultimate emergency insurance policy.